ਸਾਲ 2021 ਵਿੱਚ ਓਵਰਡੋਜ਼ ਕਰਕੇ ਹੋਣ ਵਾਲੀਆਂ ਮੌਤਾਂ ਦੀ ਗਿਣਤੀ ਕੈਨੇਡਾ ਭਰ ਦੇ ਕਈ ਸੂਬਿਆਂ ਲਈ ਵੱਡੀ ਚੁਣੌਤੀ ਬਣੀ ਹੋਈ ਹੈ, ਜਿਸ ਦੇ ਲਈ ਆਪੋ ਆਪਣੇ ਪੱਧਰ ਤੇ ਸੂਬਾ ਸਰਕਾਰਾਂ ਕਈ ਫੈਸਲੇ ਤੇ ਐਲਾਨ ਕਰ ਰਹੀਆਂ ਨੇ ਅਤੇ ਇਸੇ ਨੂੰ ਲੈ ਕੇ ਅਲਬਰਟਾ ਸਰਕਾਰ ਨੇ ਤਾਜ਼ਾ ਐਲਾਨ ਕੀਤਾ ਹੈ, ਜਿਸ ਦੇ ਵਿੱਚ ਉਹਨਾਂ ਦੇ ਵੱਲੋਂ ਇੱਕ ਨਵਾਂ ਪ੍ਰੋਗਰਾਮ ਐਲਾਨਿਆ ਗਿਆ, ਜਿਸ ਰਾਹੀਂ ਨਸ਼ਾ ਜ਼ਿਆਦਾ ਕਰਨ ਕਰਕੇ ਹੋਣ ਵਾਲੀਆਂ ਮੌਤਾਂ ਦੀ ਗਿਣਤੀ ਉੱਤੇ ਠੱਲ ਪਾਈ ਜਾ ਸਕਦੀ ਹੈ। ਇਸ ਦਾ ਸੂਬਾ ਸਰਕਾਰ ਨੇ ਦਾਅਵਾ ਕੀਤਾ ਹੈ।
Why, hello, everyone. Thank you for joining us today's announcement. I'm Mike Ellis, Alberta's Associate Minister of Mental Health and Addiction, and with me today is Dr. Nathaniel Day, the Medical Director of Alberta's Virtual Opioid Dependency Program. We're here today to talk about the illness of addiction. Addiction continues to have an impact on our communities, especially when it comes to the tragedy that is opioid overdose. This illness of addiction continues to claim the lives of Albertans, and my heart goes out to all those who we have lost, and families and communities that have been impacted by it. However bleak the situation may be at times, there is hope for people with addiction, as we know the treatment works and that recovery is possible. It is the hope that has formed our response to addiction, and we have made great strides to improve access to treatment to help more Albertans enter recovery. On Saturday, I stood with Premier Jason Kenney as he announced that our government has doubled our commitment by funding 8,000 annual treatment spaces, and we did it 2 years ahead of schedule. This means that over 8,000 Albertans will be able to access life-saving medical detox, residential treatment, and residential recovery services every year. All of this with no user fees. We are building a comprehensive recovery-oriented system of care that gives everyone access to treatment and hope for recovery. In addition to the expansion of publicly funded bed-based treatment, we have also been expanding access to evidence-based medications. Last quarter, we had the highest level of evidence-based medication dispensing on record, and we will continue to support these interventions. And that brings me to the first part of today's announcement. So Alberta's government is employing a new tool in the fight against opioid overdose. Ladies and gentlemen, this is Sublocade. Unlike the tablet-based version that lasts 24 hours, Sublocade is injected and lasts in a person's system for 30 days, providing stabilization, reducing cravings, and significantly enhanced protection against overdose. That means Albertans pursuing recovery are not required to attend the pharmacy daily to receive their treatment. It means less sleepless nights for parents and loved ones who wait up at night for that dreaded phone call. And it means that our homeless and our vulnerable population don't need to worry about destabilizing as a result of not taking their medication. Starting immediately, the Sublocade injection is fully funded and available through the Public Benefits Plan and the out-gap coverage program like any other medication. The addition of Sublocade to the publicly funded formulary and its removal from special access will significantly reduce barriers to this medication. Recovery-oriented care is about providing options to Albertans with addiction, and this option will save lives and support recovery. In addition to covering the cost of Sublocade, I'm also announcing that Alberta's government is providing Alberta's award-winning virtual opioid dependency program with an additional $1.4 million annually, bringing our total increased funding to $6.4 million. Alberta is the first jurisdiction in Canada to achieve treatment on demand. This means that any Albertan with an opioid addiction can receive treatment on the same day with no wait list, with no fees, anywhere you live. The $1.4 million will support the virtual program to create low-barrier harm reduction division that will do rapid assessments and provide enhanced case management for vulnerable clients. With this additional funding, they will be able to serve more Albertans, build more relationships, and ensure that more people reach their goals in recovery.